Well, if you happen to be experiencing some carpal tunnel issues, our next guest is here to help.
Yes, he is Dr. Grabow. He is a surgeon and expert in Nevada for carpal tunnel surgery, utilizing a unique and virtually painless method to treat carpal tunnel issues. Doctor, so great to have you.
Great, I'm excited to be here.
Yes, we understand you watched the show, so it's
Yes,
so
I do.
exciting to actually have
I know,
you
it's like
in now.
meeting a pair of friends, so it's great.
Thank you.
We're thrilled. Can we start off, we know you're an expert in this field. For those people who are experiencing carpal tunnel, they know what it is. Some people don't know what it is. Can you explain the condition?
Sure. So in your hand, you have a major nerve called the median nerve that as it travels from your wrist into your hand, it goes under a ligament with all the tendons that move your fingers. In carpal tunnel syndrome, that nerve gets compressed and you get some classic findings. You get some numbness and tingling or pins and needles in your thumb, index, and long finger. Some people it's so bad that it's constant numbness. And then pain, patients can have pain in their fingers constantly. They can have pain when they're doing things. It could even radiate up their arm.
Wow.
Yes.
Well, we know you're one of the best here in Las Vegas and in Nevada. How did you kind of get the experience to be one of the experts that we have now?
So for carpal tunnel, I've been doing this since 2006. And obviously as technology advances, as surgeons, we learn the latest and greatest, not so much because it's a new fun thing to do, but more importantly, there are better things to provide our patients.
Yeah.
So during COVID, obviously everything was shut down, and we've always done lots of procedures in our office setting under no sedation because patients prefer that. But during COVID, I had patients who were on schedule for carpal tunnel release and they couldn't go to surgery and we didn't know when that was going to happen. And I had patients begging me, can you do something to relieve it? So we started doing the mini opens in our office, which is commonplace in Canada. That's pretty majority of them are done. But in the United States, just because of the convenience of the operating room, we were doing it in an operating room.
Doctor, you
Yes.
said a mini open.
Right. So
what is that?
So a mini open is a small incision about an inch long in your palm. It's basically open carpal tunnel. What that means is we make an incision through your skin, so your soft tissues down, and we cut the ligament. Because at that time, there was nothing really else available to do in an office setting or procedure room suite without anesthesia. And so once I did that, the patients were ecstatic. They're like, oh, thank you so much. Not only because they got it relieved, but they said it was such a relaxing experience. And so I sought out more minimally invasive techniques to do it. And now I got extra training specifically in ultrasound guidance. So now I'm able to utilize this device. There's less than 100 doctors in the country who are able to offer this procedure.
Wow. I absolutely respect that, and I understand the importance for a surgeon of keeping up to date with what is not only cutting edge, but is safe as well.
Exactly.
You have an ultrasound machine that you brought in today, and that really plays into your treatment as well. Can you explain this?
Certainly, yes. So what we like to say is we're Nevada's only hand surgery ultrasound expert. And what that means is we utilize this device, an ultrasound machine, to guide when we're doing procedures. So it's kind of like Superman. We can see inside you and see all your anatomy live while we're doing the procedure. And that's the magic of this procedure. It's not the device, but it's that with ultrasound, I can see your nerves, your tendons and blood vessels, all your hand anatomy as I'm doing the procedure. So it makes it not only a safe and effective procedure, but elegant as well, because the incision is the size of a Tic Tac.
Right.
Elegant.
And I think there's a lot of people out there that might be sitting and watching this and thinking, this might be me. Like, who do you think is the ideal candidate to come and check you out and learn more about this?
That's a great question. So every year, there's about 13 million people in the United States diagnosed with carpal tunnel. About 2.7 million have it bad enough they need surgery. But only 600,000 people actually have surgery every year. So you'd say, wait, 2.7 is only 600,000. Most people are scared of anesthesia. They're scared of going to sleep.
Sure.
And then the second most common reason is return to work or return to caring for my child or my family.
Yeah.
So the beauty of this, it's no sedation. We use local anesthetic just like the dentist. We use a microneedle to inject it, so there is really even no pain. Most patients don't even know we've injected the numbing medicine, and then after that, they don't feel anything at all.
Boy, yeah.
But return to work, that's where the magic happens. Patients can use their hand immediately after. So if they use canes and crutches and walkers, they're able to use that. They can drive, they can care for their child or the loved one, and then 3 to 6 days later, majority of patients are back to work in their full activities.
Well, and I think that's huge because that probably does keep a lot of people from pursuing the surgical
number.
option. Before surgery, are there also other treatments, like just non-surgical options?
Well, yes,
carpal tunnel as well?
that 13 million who are diagnosed, 2.7 million need surgery. A vast majority of people have mild carpal tunnel where stretching exercises, modification or activity, so you take some breaks, exactly that. Sometimes people take anti-inflammatories, wear a brace at night.
Yep.
And then if they need to, we'll do a steroid injection to the wrist, and that makes it solve a lot of people's problems.
So many options. Hey, we want people to be able to connect with you. And real quick, there's an event coming up where they can actually get a free consultation later in the month.
Yes, we're pretty excited about this. We're part of the Las Vegas Health and Wellness Expo. That's on October 22nd. That's
Yeah.
going to be at the
Saturday.
Gold Coast Casino. And so we have a booth there. We're doing free ultrasound screening exams of the carpal tunnel. So patients can come there. We scan the wrist. We look at the nerve. We can tell if the nerve is enlarged, and that's a telltale sign for carpal tunnel. And then we can discuss with them any questions they may have.
Dr. Grabow, it's been fascinating to learn about carpal
Yes,
tunnel.
thank you for coming
so
in
much.
today.
Thank you.
Yeah, it was
We
amazing.
just got a lesson.
I know.
Didn't
it made me
we?
nervous because I crack my knuckles a lot, so I'm like, maybe I need to.
Tell him not.
And maybe I should
it's
stop
not
doing
good,
it.
Surprisingly,
right?
there's nothing wrong with that.
Oh!
Thank you. You've confirmed to me. I've said it. There's
Oh.
nothing wrong with it. The doc told me,
Darn
people.
it, doctor, we need to talk on the side.
Yeah, there
All
was
right.
a, yes, they actually did a study, like a
Great
literally
job.
study on
Visit
that.
nosedationhandsurgery.com or call the number right there on your screen, 833-HAND-VIP. That's 833-426-3847.